Good morning, everybody. Okay, my name is Dr. Ifunanya. I'm a corporate doctor that is working here. I started working here this month. So, and I am interested in maternal health, mother and child health. So, when I started working, I noticed that people come for antenatal here, and in the east where I come from, I go for advocacy like this. I go to talk to pregnant women in villages, or people who are not pregnant but will be pregnant someday, to teach them things they should know even before they get pregnant and when they are pregnant. So I want to start it here by God's grace every Monday. I'll come here, take some specific questions. We are not going to rush it. I'll just be taking it small because I have a clinic to catch up with. Also, I came around like 30 now. So today we have just about 5 questions that I want to address. They are basic things that you need to know. One of them is something that you can do before you get pregnant, and others are things that you can do now that you are pregnant. So we are going to start. Okay, the name of my organization is Live Mother and Child Initiative, and we have been doing this for 2 years now in Anambra State. So the first question today is, when is the right time to book for antenatal? Because I notice a lot of women, they come in and say, I'm waiting for 6 months, I'm waiting for 5 months. Our doctor, the belly is still small now. I just laugh and I tell them, the right time to book for antenatal is as soon as you know that you are pregnant. As soon as you miss your period and you suspect that it's like I'm pregnant, and you go for urine test and blood test and they tell you that it is positive, the next thing you should do the following week is to go to a hospital where you want to book for your antenatal and do what? And see a doctor. You ask me, it's too early now. Yes, to you it's too early, but to us it's not early. The reason is this: there are some problems that can come up within the first 2-3 months of pregnancy, that if you are booked in a particular center and a doctor is monitoring your pregnancy, the doctor will be able to detect that problem early and do what? And tackle it. Example of things that can happen if in that first is that you can start bleeding, and your neighbor will be telling you, it happened to me, I was menstruating when I am pregnant. But it is not normal. You are not supposed to be menstruating when you are pregnant, and it is not menstruation, it is bleeding. So when you are booked early and you tell your doctor, I am still menstruating, the doctor will say, you are not supposed to. So they will look for what is causing it. If it is miscarriage that you are about to have, and it is something, there is something they can do about it, they do what? They do it. There is another thing that claims women's life. One of them is ectopic pregnancy, and it occurs in the first trimester, first 3 months. So imagine if you are not booked early for antenatal, and then all of a sudden you faint at home. Then your husband come and pour you water, or the person there pour you water, and then you wake up again, you eat rice, then you faint again. And before you faint 3 times, you have become unconscious. And then they will not know what is happening to her. She was not sick, she was not having fever, what is happening? And before you know it, you land in the hospital, and you will be tired, the hospital is far, and there is hold up on the road. Before you get to hospital, you will die. Because it takes life, like you just snap and the person is gone. So but if you are booked and your doctor will tell you, if this kind of thing happens to you, please call me immediately or report to the hospital immediately. So that if you start feeling like, I want to faint, you will not even faint. Once you start feeling like it's like I want to faint, you do what? You report to your doctor immediately, because that thing is very life-threatening. It can kill you immediately. So that they can do what? Do surgery and do what? And intervene immediately. So these are a few reasons why you need to book early. Another important reason why you need to book early is because of the drugs you are supposed to take, especially folic acid. Folic acid is very important if you start it very early in your pregnancy. When we go further, I will talk about why it is important and why folic acid is very important. There's another thing I want to talk about. So women will ask me, but is there anything I can do before I get pregnant to help me when I am pregnant? Yes, there's a lot of things you can do before you get pregnant. Number one of them is that if you feel like, I think I am ready to get pregnant, you go and see a doctor. Tell the doctor, ma, sir, I want to get pregnant. I want to examine myself and be sure that I'm even fit to carry a pregnancy. Because some people are not fit to carry pregnancy. If you are having some diseases and you yourself, you are not even fit to sustain yourself, why will you go and carry pregnancy? Then, if you go before you are pregnant and they test you for infections like HIV, hepatitis B, hepatitis C, syphilis, and screen you for diabetes and hypertension, don't you think that is wonderful for you to know that I am HIV negative, I am hepatitis B negative, C negative, I don't have diabetes, I don't have hypertension, so okay, I can go into this pregnancy. Or you know that you are positive in one of them and you start receiving treatments and come up to a stage where you are fit to carry pregnancy so that the infection won't affect your baby. So these are things you can do before you get pregnant. And that thing you can do before you get pregnant is you can start taking folic acid before you get pregnant. You want to get pregnant this year, by April, you want to try to start getting pregnant, you can start taking folic acid by January. The folic acid you take, your body will store it, and it will even serve you when you are pregnant. It is the base for you to take folic acid even before you get pregnant. So these are few things you can do. There are a whole lot of them, but these are few things that are common, that are not money consuming, that you can do before you get pregnant. At least know your genotype too, know your blood group, so that if you are saving money, let me tell you an example. If you're hepatitis B positive, it means that you are going to save money before you get pregnant, because your baby will need something we call immunoglobulin when the baby is born, so that baby doesn't contact the hepatitis B. And if you are HIV positive, it means that you know that the center you are going to deliver your baby, they should have drug that they will give to your baby. Within 73 days, the baby is born, so the baby will not get HIV. And before you even get pregnant and you're HIV positive, your doctor will explain to you about your feeding options, about how you are going to go into labor, explain those things to you. You'll be familiar with it and you prepare your mind that, okay, I am HIV positive, it's not a death sentence. I can still be pregnant and this pregnancy will have a good outcome and my baby will be fine. So before you get pregnant, you need to check yourself and how about these things in your mind. Another thing I want to talk about is importance of routine drugs, because some of us, we are careless. We don't want to take pills, we don't want to take drugs. They smell a lot. Yes, I've been pregnant, so I'm not talking to you as a doctor. I'm talking to you as your fellow woman who has been pregnant before and has passed through this process and knows what it feels like to wake up every day and take pills. I know what it feels like, and I'm someone that doesn't like taking pills. So I have that pain, I know how it feels. But antenatal drugs are very important. I didn't say about it, before you get pregnant, you're supposed to know your blood level. Because if your blood level is low, it means that you are supposed to do what? Supposed to raise it up. The doctor will help you to tell you things to eat, what to do what? To raise your blood level up before you get pregnant, so it will be able to sustain you and your baby. Then, another thing is that antenatal drugs are very important because, first of all, folic acid helps to build your blood, and it helps to do what? To build and protect your baby from different things. First, you have seen babies that when they are born, their back, something will come out from their back like this. Some of them, their mothers, they do not take folic acid when they are pregnant. So they have what we call spinal bifida. If that spinal bifida happens to your baby will not know. It will need surgery for correction, one. And imagine you now give birth in one center that the a birth attendant is not trained and they go and use needle and rupture the thing and the thing gets infected. Just imagine it. Then imagine the money you will spend to go for surgery to correct it. Imagine your baby not being able to know when he wants to urinate in the future. Imagine your baby not knowing when he wants to poo-poo in the future. So folic acid is very important. You see some babies, their legs are like this when they are born. We call it talipes alpinum. Their legs are like this. But because of folic acid, that yellow soda that you just take, you have destroyed your baby. So antenatal drugs are important. I will tell you practical things that helped me, because I am not here to speak medical jargon to you. When I was pregnant, I don't like smell of physolate and some of B-complex and the So what did I do? In the first trimester of my pregnancy, I made sure that I took folic acid religiously, the way you pray in the morning. I took it religiously. And then, because I don't want to take multiple pills, I resort to alternative syrup and blood tonic. So while I am taking folic acid tablet because it doesn't smell, I take blood tonic together with it too, so that I can get iron and other things I need from the blood tonic. So it's not a rocket science. If you cannot take the pills, there are alternatives, but don't just stay like that. Folic acid doesn't smell, take it, then alternate other ones, okay, so that your blood level doesn't drop. Because if it drops, you are going to receive blood either during labor. Okay, you don't even know whether your pregnancy will end up as a vaginal birth or as a cesarean section. And then what if you end up as a vaginal birth and you now bleed a lot and your blood is already below 10 and you are bleeding? It means that you are going to get blood. You know how much 1 pint of blood is in Lagos? I don't want you to think about it. So it's better you take your pills and eat vegetables, so you'll be able to do what? Protect yourself and protect your baby. And that's it. Some people say, is it every 2 weeks? I'll be coming for this antenatal. Yes, you'll be coming because we want to be seeing you and know how you are progressing. For the second trimester, we want to see and know how you are progressing. We want to see and know when you have developed problems. We want to check your urine, so that once we see something, we're not checking your urine because we love the smell of your urine. No, we are checking your urine because we want to check, is there protein in your urine? Is there sugar in your urine? These things, they have significance. We are not just doing it because we want to collect 200 naira from you. We are doing it because we want to be sure that you are okay, your kidney is functioning well, everything is functioning well, you don't have sugar, you don't have, you're not developing BP. We're checking your blood pressure to be sure you're not developing BP. If you have BP, we'll tackle it immediately so it doesn't progress to another, something that is more dangerous than the BP alone. That's why we're checking your urine. If you have BP, okay, I will be checking your urine. Is there protein in it? If there's protein, we stand on our toes and start following you, JJ, to be able to do what? Because some people, they have BP, they have come from hospital, they don't come to hospital. At the end of the day, the BP becomes so bad, they start developing what we call preeclampsia, and then they will still not come to us. When they come and you advise them, they run further, and before you know it, they develop what we call eclampsia, and they will start. You see people that seizure, they will start seizure in pregnancy, and it's not good. It can take your life. So that's why you need to be coming for your antenatal. So I think I've addressed, like I told you, this session is going to be coming bit by bit. We are going to do this every Monday, bit by bit. I think I've addressed all the questions I have here. So I am encouraging you. The journey is not easy, but God will give you the strength to go through it. But you need our help. The nurses are here to help you. They come out from their houses every day to help you. It is your duty to come. Don't allow your neighbor who is not a medical personnel to influence you. They'll tell you, nah, go down and be wasting money now. They don't know that Mama K is behind our house. We used to do this thing cheaper. There's a lot of things we'll still talk about, but today, we are going to stop here. So I want to thank you all for coming for antenatal. It's not easy. People should continue coming and ask questions when you are confused. The medical personnel here are here to help you. Ask questions when you are confused. Tell us your fear. Some people will contact and tell me, doctor, I am scared though. I am very scared. And I will counsel them. I'll counsel them. If you are scared, tell us. If something is bothering you, tell us. We are here to help you. We are not just here to see your belly, touch your belly, check whether your baby is beating fine. We are here to attend to your mental health too. Because if you are not okay completely, the baby will not be fine. You will not even be able to carry pregnancy well. You will not be able to even take care of the baby when the baby is born. So please ask questions when you are confused. And if your neighbor at home, your marketplace or anywhere tells you anything, please first of all come to hospital and tell your healthcare provider, see what my neighbor said at home, what do you think about it? We are the best people to give you professional advice. Please always confirm with your doctor and your nurses before you take any decision. Don't just go to the community and hear something and run with it. Always come back here. We are here to serve you and we promise to give you the best. Thank you very much. I'll see you people next week Monday. Thank you.